ऑलराइट, रेडियो सिटी पर मेरा नाम है दिव्या और वही कॉन्वर्सेशन जहाँ पर आपके लिए बहुत सारी इन्फॉर्मेशन और यूं कहूँ कि सिंपल तरीके से जो कुछ ऐसे कॉन्सेप्ट्स होते हैं ना जिनके बारे में सोच के डर लगता है, हम नर्वस हो जाते हैं, उसके ऊपर रोशनी डालने के लिए आई एम गेटिंग द बेस्ट ऑफ एक्सपर्ट्स फोर्टिस हॉस्पिटल वसंत कुंज के साथ। एक कोशिश है कि हर वो चीज़ जहाँ थोड़ी कंफ्यूजन है उसको दूर करने की कोशिश हो, ब्रिंगिंग इन द बेस्ट ऑफ एक्सपर्ट्स। मेरे साथ आज डॉक्टर सुतोपा बैनर्जी, डायरेक्टर एंड यूनिट हेड ऑब्स्टेट्रिक्स एंड गायनोकोलॉजी विद ओवर 25 years ऑफ एक्सपीरियंस। कुछ कॉन्वर्सेशन का वो अंश अगर आपको लगता है ना कि हाँ ये बहुत सही था, तो ये आगे शेयर कीजिएगा एंड शेयर इट विद पीपल हु प्रॉब्ली वुड नीड इट। मैम, वेलकम टू रेडियो सिटी एंड थैंक यू फॉर जॉइनिंग इन।
थैंक यू सो मच।
मतलब इतनी सारी चीज़ें हो सकती है ना वुमेन हेल्थ के बारे में जब हम बात करते हैं, क्योंकि सबको देखते देखते अपने बारे में भूल जाती हैं अक्सर महिलाएं। इफ यू कैन एक्चुअली स्टार्ट विद अ क्वेश्चन फॉर एवरीवन, डॉक्टर बैनर्जी, कुछ ऐसी चीज़ें जो आपको लगता है वुमेन से अबव 40, especially if you have kids and if you've got your family, आप काम भी कर रहे हो, some things they should not remember or they should not forget.
Yeah, of course. Health is very important. I'm an health expert, so I'll be talking on that.
Yeah.
And I feel the woman is the pillar of her family.
Yep.
And when she is around 40, she's already raised up her children. She's quite stable. Maybe she's a working woman and she must be doing well in her career. And with all of this bhaga-daudi in her life, she forgets to take care of her own health.
Yeah.
So I would say to all those ladies who are at this age, because this is a very crucial phase of her life where she is transitioning from her reproductive age group to her perimenopausal and menopausal age group. So this is the time when she should be very careful regarding her health. She should take good balanced diet. She should regularly exercise. She should do own stress management. And of course, she should look for certain things which are very important in terms of, symptoms of perimenopause, menopause, and if there are any warning symptoms, then she should be aware of them. And she should also go for regular preventive checks to find out if she's at risk of some of the factors like osteoporosis, cardiovascular diseases, which happens in pregnancy. And sometimes, during this phase, there are initiation of pre-cancers and cancers of the female genital tract, like the uterine cancers, the cervical cancers, and the breast cancers. Of course, during this time, there is a lot of transition, and there are a lot of, because of the depletion of the estrogen, gradual depletion of the estrogen, there are a lot of distressing symptoms which start coming, like especially the mental health, which is related to the mood swings, the irritability, sleepless nights, hot flushes, night sweats. There's a lot of decrease in her libido, in her vaginal dryness. There's a lot of vaginal dryness, painful intercourse, loss of bone, loss of muscle, and so on. So in all of this, she needs to find out her me time, to find out what's going wrong, if there's anything that she needs to consult, if she needs to take special dietary supplements, if she needs to consult a doctor for all of these. So this is what I would like to tell all my viewers and my women friends about this phase of her life.
सो बेसिकली रेगुलर चेक्स की ज़रूरत है, मी टाइम की ज़रूरत है, अपना ख्याल रखने की ज़रूरत है, और अगर लगता है कि हाँ समथिंग्स नॉट फीलिंग ओके, तो कभी कभी अपनी गट की सुन लेनी चाहिए एंड यू शुड सी अ डॉक्टर। मेरे साथ आज डॉक्टर सुतोपा बैनर्जी, डायरेक्टर एंड यूनिट हेड ऑब्स्टेट्रिक्स एंड गायनोकोलॉजी, प्रैक्टिसिंग वुमेन्स हेल्थ, हाई रिस्क प्रेगनेंसी मैनेजमेंट, एस्थेटिक गायनोकोलॉजी एंड बहुत सारी चीज़ों पे बात हो सकती है। बट मैम, मेनोपॉज का आपने जिक्र किया था, एंड अगर हम सिंपल तरीके से समझ सके कि मेनोपॉज आखिर क्या होता है, व्हाट इज़ मेनोपॉज?
Menopause, firstly, is a very natural and physiological process. It's not a disease or anything. And what happens is it is marked by the complete cessation of her periods, and ovarian function, and also hormonal depletion of estrogen. That is one of the most important hormones which is responsible for maintaining good woman's health. Her mental health, her bone health, her muscle health, her vaginal health, all of it. So there's a lot of, loss of hair, thinning of hair, so many things keep happening. And of course, at this phase, when the estrogen is depleting, there are serious disorders which can happen, and she's at risk of developing osteoporosis, which is like the risk of having fractures, even with trivial injuries, or with spontaneous fractures, and at cardiovascular risks.
Right.
So this is what is menopause, and it usually starts in the age group of 45 to 55. But some of the women can have an early menopause, which is between 40 to 45 years of age, and some of the proportion, which is very few, but still, some of them can have a premature menopause, which is less than 40 years of age. And they are the women who are at very high risk of developing all these symptoms, and also of the risks of the long-term complications of menopause.
Ma'am, then obviously the next question would be, इसको manage कैसे करें जब menopause आ जाता है? The phase is, I'm sure it brings in a lot of emotional upheavals. मूड चेंज होता होगा, कैसे मैनेज करें?
ऑफ कोर्स मेनोपॉज सुनते ही लगता है कि पता नहीं क्या चीज़ हो रही. इट्स जस्ट लाइक एनी अदर फेज ऑफ योर लाइफ. इट इज़ बाउंड टू हैपन. सो बिकॉज इट्स natural and physiological, there has to be an acceptance that okay, now I'm going into this phase of my life and this is how I will manage.
Yeah.
So there are very natural ways of managing things, like a good lifestyle, which is applicable for every phase of your life. So a good, balanced, clean diet, regular exercises. Of course, stress management is very, very important in this. So I would like to specially mention a few things which are very important in menopause. What are the supplements which you should think very, very specifically in menopause? So some of them are like calcium, very important. So the daily requirement is almost about 1,000 to 1,200 milligrams per day. And of course, you don't need to always take a supplement in terms of a tablet. There are dietary sources also, like, the dairy products, the green leafy vegetables, the fortified foods, and the seeds. And all of these can have a lot of calcium. The other one is vitamin D. Very, very important. And the daily requirement, it is a sunshine vitamin. And the daily requirement is almost about 600 to 800 international units per day. However, there are certain dietary sources also, like the egg yolk or the salmon fish or the cod liver oil. The other one is magnesium, extremely important. These days it is coming up as a good nutritional supplement in maintaining the bone health and the mental health also. There's a special type of supplement that I would like to highlight, which is the phytoestrogens. Now, what are phytoestrogens? Phytoestrogens are, it's like a natural hormone therapy. Like estrogen gets depleted in menopause. So how do you replace it? So you have plant-based phytoestrogens.
Yeah.
And they are by the name of isoflavones and lignans. And they are in the soya products, the soya beans, the tofu, soya milk, and soya nuggets. And the lignans are there in the flax seeds, in vegetables, fruits, and the lentils. Also, I would like to tell about the role of protein, because it's the protein loss which happens with this age, and you get bone loss, muscle loss, hair loss, and all. So 1 to 2 grams of protein per day is a must for all these women, and it's plenty available in plenty in the dietary sources, like the dairy products, non-vegetarian diet, and the lentils. Of course, the other vitamins like vitamin E, then if you have to talk about omega fatty acids, B6, B12, probiotics, extremely important for gut health and vaginal health. And also there are certain herbs which are rich in these natural estrogens. So one of them is black cohosh, which is actually an extract from a North American plant root. And it has been extensively used in postmenopausal symptoms, and it has been found very useful. And also there is something called a red clover. So these are some little things about the diet. Now let's come to the exercises. Now, what specific exercises are we supposed to do in a menopausal phase of your life? Walk, very simple.
Yeah.
So go for a walk for 45 minutes every day, at least 5 times a week.
Yeah.
But you have to concentrate on strength building. Sometimes, at this age, people say, हम तो सैर करके आ जाते हैं. But how do you build up your muscles? How do you strengthen your bones? So you actually should do strength building exercises like weight training. आप कहते हैं अरे 45 में 50 में weight करेंगे. So it's like, you have to do strength building exercises. You should do yoga for it. And I would like to specifically tell about a pelvic floor exercise which is known as the Kegels. it's a very important exercise which strengthens the pelvic muscles. And when your pelvic muscles go weak, then you're prone to developing uterine prolapses, laxity of vagina, stress urinary incontinence. So actually this exercise should start from your reproductive age group after the childbirth, because there is laxity of the vaginal muscles, the pelvic muscles. So it should start from then, and it should keep continuing.
Wow.
As far as stress management is concerned, you should have good sleep, very important. 7 to 8 hours of good uninterrupted sleep is a must.
Yeah.
You should have your me time. You should have time to travel. You should have time to spend with your friends. Go for meditation and go for music therapy, go for reflexology, whatever makes you relaxed.
Wow.
So these were all about some of the natural things. And these days, because I practice gynae aesthetics also, so I would like to tell something about how you have a good vaginal health. Because everybody talks about osteoporosis and cardiovascular diseases. Hardly people talk about vaginal health.
Yes.
And even the woman doesn't talk about it.
Yeah.
So there is a lot of vaginal dryness, a lot of discharge, painful intercourse during this time. And gynae aesthetics has natural ways of managing it, like using PRP, which is platelet-rich plasma. So that helps a lot with vaginal dryness. Also, you can use vaginal moisturizer. So a lot of these things are coming up, and they are being used and have been found to be very helpful.
And I think that's the whole thing, ma'am. People need to not be shy. और मुझे लगता है कि हम लोग कितनी बारी symptoms इसलिए छुपा के रखते हैं कि कैसे बताएंगे. But the point is, if you talk about it, it is your life that gets better at the end of the day.
That's true. But there would be some women who may not be completely okay with whatever these things we are doing. So some may need medical help, and they may need something like a hormone replacement therapy.
Yeah.
So hormone replacement therapy is actually what happens is there is estrogen depletion. So you just replenish it from externally with the help of estrogen tablets, creams, vaginal creams, transdermal creams, and patches. But yes, that needs individualization. Who are the women who are supposed to... it's a boon for women who have a lot of very, very distressing symptoms, especially hot flashes, mood irritability, and, mood anxiety, mood swings, anxiety, depression. For them, it's a boon. It helps. And also, especially women who have gone into menopause very early in life, for them, they're at a very high risk of developing cardiovascular diseases, and also with the risk of osteoporosis. So for them, it's really good. However, there are certain contraindications, and there are a set of women who can take it. For how long it should be taken? What is the dosage? Is there any other, conjunction with any other medicine you have to take it? Like, if you have to take a estrogen with a woman who has an uterus, then there should be some supplementation with progesterone also to balance it. So all those things are definitely there, because there can be risks with the hormone replacement therapy, like serious ones, like the thromboembolism, which is blood clotting, or maybe there's some risks of endometrial cancer and breast cancers. But then, if you take them at the right indication, at the right age, with the right duration, with a proper dose, then it's absolutely wonderful.
So, but I think, ma'am, so what I would want to add is that ये doctor की prescription और recommendation से ही होगा.
Of course. But ये patients को इसलिए पता होना चाहिए, so that they know, okay, I'm having these things, I need to see a doctor. That's what. Yeah. I would also like to tell about, preventive.
Yeah, I was about to ask the preventive health checks, because I think वही यहाँ तक lead करेगा. But yeah, if you can talk about the preventive health checkups.
Preventive health checkup is now very popular amongst all of us, and people do come for their checkups. But still, it has a long way to go, because you don't have any symptoms, and that time you have to go to the doctor.
Yeah.
So it's very difficult sometimes to pull yourself up and go for a preventive health check. For these women who are in their perimenopausal and menopausal ages, we have a special initiative from Fortis Vasant Kunj. We have a dedicated menopausal clinic.
Wow.
Called Sahajini.
So, ma'am, of course, we've spoken about people and, the hormones and the changes in the body. Now, there is also, especially I'm going to play this during the Navratra week, there are also women who are now independent and not married and, in their 40s, not having a child and plan to have a child. Is there a word for them in the sense, how do they take care of themselves? Of course, we are working, they're independent.
See, what I can understand is that, every woman wants to have a child at
Yeah.
some part of her life.
Yeah.
But the biological clock and the career clock, they actually
Yeah.
coincide together. So when you're trying to achieve your peaks, that's the time when you have to have a baby also. So for them, it's good to maintain a good lifestyle so that your fitness levels are good. And it's not always necessary that just because that you want to have a child, that you will, jump into a marriage. You should have a good partner. You should know about your partner and be sure of the partner. So these days there are many medical helps wherein, you can preserve your eggs and you can freeze them and keep them for later.
Yeah.
But this decision or this, to the willingness to go in for something has to come a little early.
Yeah.
It should not be when, you are going on the downhill of your reproductive health that you decide for this. This is a conscious decision which you have to take much way ahead, and you have to see your how your life curve will go.
Yeah.
So I would like to tell all of these women that, okay, there can be pressures of marriage and pressures of having babies, but the woman only can do this. So all
Yeah.
the pressures will be on her only.
Yeah.
But she has to manage it. She has to see her career. She has to see her life. She has to see a right partner who she gets. It is not necessary that you'll get your right partner at the age of 25 or 30. You may get it later. So you just don't have to, change your path for that. There are other ways for maintaining your fertility, and that decision should come early. You can see your doctor. You can see whether you're in the right reproductive health wise, are you okay or not, and then you can think of preserving your eggs for future.
थैंक यू मैम. यू नो व्हाट आई रियली अंडरस्टैंड, इतने प्यार से समझाया गया है ना सब कुछ, एंड आई थिंक ध्यान रखना है. और मुझे हर चीज़ से ये समझ आ रहा है दैट मेंटली यू रियली हैव टू बी इन अ गुड स्टेट. एंड आई थिंक विद वुमेन सबसे इंपॉर्टेंट चीज़ वही है. इफ यू आर मेंटली वेल, everything else falls in place. मैंने कहा मैम, any final words for everyone who's watching this or they're listening to you on the radio?
I would say please take care of your health always, because health is priority. If you don't have health, you don't have anything actually. And
Yes.
if health is there, everything will follow by. And we all know that lifestyle is, we may have medicines, we may have doctors, but what you can do for yourself, nobody can do it for you.
That's true.
So I think you just have to take care of yourself. Put your health, put yourself on priority, and you'll be able to do everything for everybody else.
I love it. What you do is for you. अगर आप अच्छे हो, आप फिट हो, तो सब कुछ हो सकता है. एंड आई लाइक द बिट, हेल्थ इज एवरीथिंग. प्लीज़ अपना ख्याल रखिए मेंटली, फिजिकली. एंड लाइक मैम सेड, प्लीज़ जाइए, पैकेजेस हैं, रेगुलर चेक से बहुत चीज़ें कंट्रोल रह सकती हैं. थैंक यू मैम फॉर ज्वाइनिंग इन. डॉक्टर सुतोपा बैनर्जी, डायरेक्टर एंड यूनिट हेड ऑब्स्टेट्रिक्स एंड गायनोकोलॉजी, ज्वाइनिंग अस फ्रॉम फोर्टिस हॉस्पिटल वसंत कुंज. थैंक यू फॉर वॉचिंग दिस. और अगर चीज़ समझ आई है ना, तो वीडियो आगे शेयर कीजिए और पॉइंटर्स दिमाग में रखिए. थैंक यू फॉर वॉचिंग दिस.